afternoon. My name is Sherika Warfield, and today we're going to assess the gastrointestinal tract and the urinary tract. Who do I have the pleasure of assessing today?
Andre Smalls.
Okay, Mr. Smalls. At various points throughout this assessment, it will involve me putting my hands and/or my stethoscope on you. Is that going to be okay?
That's fine.
Okay, great. So first, I have a couple of questions for you. As far as your gastrointestinal tract is concerned, are you having any issues right now with diarrhea or constipation?
No.
What about, have you ever noticed any blood in your stool?
No.
Any difficulty passing a bowel movement?
No.
Do you have any family history of these things?
No.
What about any issues with like polyps or anything, or colon cancer for you?
No.
What about a family history of colon cancer or
Yes.
polyps? Yes. And so since he said that he has a family history of colon cancer, we would investigate a little further, and based off his age, the physician would just know whether or not he needed to be screened for it. So what about any family issues with anything pertaining to like GI issues such as diverticulitis or diverticulosis?
No.
No. Okay, great. So now we're going to talk about your urinary tract. Any issues voiding?
No.
No. What about, have you ever noticed any blood in your urine?
No.
Have you ever had any issues with kidney stones or urinary tract infection?
No.
Any family history of these things?
No.
Have you ever had been told that your family has a history for bladder cancer or any type of kidney cancer?
No.
No. Okay, what about pyelonephritis, which is inflammation of your kidneys, and family history of that as well?
No.
No. So since all of his answers to the urinary tract systems are no, we're going to proceed further with our assessment. Okay, Mr. Smalls, I'm going to have you lay down for me. And we are going to expose your abdomen. And so first we're going to inspect the abdomen. And we're going to note it for symmetry, color. We're going to note whether or not we see any visible masses or lumps or bruises. And I do not see any of those things. Because of his frame, we're also not able to see peristalsis or vibrations from where the abdominal aorta is. All right, Mr. Smalls, we're going to go forward. I am going to auscultate your abdomen. And I would also like to note that his abdomen, the shape of it is flat. So when auscultating the abdomen, we're listening for bowel sounds. And that involves using the diaphragm of the stethoscope. Mr. Smalls, we're going to start in the right lower quadrant. And then the right upper quadrant. The left upper quadrant. And then the left lower quadrant. Okay. When auscultating for bowel sounds, what you would want to hear is the presence of the first bowel sound. From that first sound, you will time it to see if you have a bowel sound within the next 5 to 15 seconds in each quadrant. If you have that, which he does, we would call that active bowel sounds, which is normal. If it took longer than 15 seconds to hear that second sound, we would call that hypoactive bowel sounds. And if it was less than 5 seconds until we heard the second sound, that would be considered hyperactive bowel sounds. Now, in the case of not being able to hear bowel sounds, we would auscultate each quadrant for a full 5 minutes. If we are unable to hear any sounds, we would call that absent bowel sounds. Okay, Mr. Smalls, and now I'm going to auscultate your abdomen as well, but this time with the bellow of my stethoscope, and what I'm listening for is bruise in the major arteries within your abdomen. Okay, and first we're going to start with the abdominal aorta, which is just under the xiphoid process, and it's midline of the abdomen. We're going to slide over to the right side and listen for the right renal artery. We're going to come directly over and listen for the left renal artery. We're going to go straight down and listen to the left iliac artery, which is in the center of the left lower quadrant. And then we're going to slide over and listen to the right iliac artery, which is opposite of the left. I did not know any bruise in any of those arteries, and so now we're going to go on to the next step, which involves percussing for abdominal sounds. Okay, Mr. Smalls, this is going to involve me putting my hands on you, and I'll be tapping on various spots of your abdomen, listening for the sound that it produces. Okay, we're going to start with the right lower quadrant, the right upper quadrant, the left upper quadrant, and then the left lower quadrant. Okay. Normal abdominal sounds are they're gonna sound timpani, which is a high-pitched sound. If it sounded dull, then it would encourage me to go a little bit further and investigate for masses, enlarged organs, stool impaction, things of that nature. Okay, and so now we're going to palpate. And first I'll do light palpation, which is about 1 centimeter deep, and it'll involve just one hand. And what I'm looking for is muscle tone, and I'm trying to see if I can feel any masses, but please let me know if you feel any pain or tenderness as I palpate. Right lower quadrant first. Any pain or tenderness?
No.
The right upper quadrant, any pain or tenderness?
No.
In the left upper quadrant, any pain or tenderness?
No.
And then in the left lower quadrant, any pain or tenderness?
No.
Okay, upon light palpation, his muscle tone is firm, it's resilient, like a little rubber band. And then I noticed that I did not feel any masses or lumps. So now we're gonna do deep palpation in the same order, starting with the right lower quadrant. Non-dominant hand goes on bottom, dominant hand on top. Okay, Mr. Smalls, this is gonna involve some pressure. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Right upper quadrant. Any pain or tenderness?
No.
Left upper quadrant. Any pain or tenderness?
No.
And then left lower quadrant. Any pain or tenderness?
No.
Okay. All right, Mr. Smalls, I'm going to have you sit up. That will conclude the assessment of your abdomen, but now we're going to assess your back, and what we're looking for is what's called CVA tenderness, and it will involve me percussing over where your kidneys would be on your back. So I'm going to have you reposition, and I'm going to expose your back. And so to assess for CVA tenderness, we're going to find the 12th rib, and then we're going to place our hand just a little bit below it, and it will involve me percussing twice to see if he feels any tenderness. Okay, Mr. Smalls, please let me know if you feel any tenderness.
No.
And we'll go one more.
No.
And then we're going to go over to the opposite side and assess his right kidney for tenderness.
No. No.
Okay. And that will include conclude the assessment of the GI and the urinary tract. Thank you and have a great day.